Hello, Gloria Matthews. My name's Tylea Bryant. I'm your home health nurse, and today I'm going to be teaching you how to mix your insulin. So it looks like we're going to be talking about NPH insulin as well as regular insulin. So you can follow along with me during this PowerPoint. It should be very helpful, and just let me know if you have any questions. All right, Gloria. So this is just an overview of your insulins that you were prescribed. You have your regular insulin, that is your short-acting insulin. It's administered subcutaneously. You should take this 30 to 60 minutes before meals. Onset is 30 to 60 minutes, peak is 2 to 4 hours, and duration is usually 5 to 8 hours. And then you have your insulin NPH. It's an intermediate insulin, so it's going to last for the whole day. So you take this once a day. You'll take this 30 minutes before your first meal and 30 minutes before supper if necessary. Your onset is 1 to 2 hours, peak 4 to 12 hours, and duration is 18 to 24 hours. Okay, now hypoglycemia is one of those things you want to look out for when you're taking insulin. So hypoglycemia, the symptoms or the signs that you have this would be temporary paralysis, low energy, extreme tiredness, you're hard to arouse, you have loss of consciousness, and it's just like drunken-like behavior, so slurred speech, staggering, combative behavior, and as well as confusion. And the most serious would be like seizures and convulsions. Since you're depriving your brain of that glucose that it needs to function, seizures or convulsions would be a result of hypoglycemia. Also, the telltale is going to be your blood glucose levels. So if you draw those and it is below 70, you have hypoglycemia. So I recommend calling your healthcare provider if this is ever experienced. Okay, so now we're on to how to store this medication. So you would always want to put this in your refrigerator, never the freezer, never buy anything that's extremely cold. So you should never store it with ice, and once it's opened, it should go into the refrigerator. So never just leave it sitting out. And you also must check the expiration date before every use. All right, so your orange cap syringes are your insulin syringes, and these are the only syringes you're going to use. If you have a pen, you're able to use those, but for this skill I'm going to be teaching you, I'm going to be showing you using one of these insulin syringes. So they're measured in units. They range from 30 to 50 to 100 unit syringes. You're always going to want to use a 1/2-inch needle. And just so you know, like counting wise, like counting the little lines on the syringe, they go by ones. You're never going to use a syringe that's measured in mLs because that is not how we measure insulin. And when discarding your needle that you just used to administer your insulin, you never want to pick up the cap and recap it. You always want to try and scoop the cap up, or you can just throw your needle straight into the sharps container or the container. I'm going to show you what kind of containers you can use to dispose of these needles, but just never pick up the cap and put it on because you can put yourself at risk for poking yourself and injuring yourself. So any of these containers that are shown here are acceptable containers for you to throw away your needles, your sharps into. So we have the old milk carton. That is a good disposable container because it's thick. You can't really poke through it with a 1/2-inch needle. So that's acceptable. You can also go to CVS or any pharmacy really and find you an actual needle collection disposable little container. And also old detergent bottles will actually work as well. So here I have listed some instructions and some ways that you can avoid contamination when performing this skill. So main key points, I'm going to show you the skill at the end of this PowerPoint, but main key points, you always want to scrub your vials for 15 seconds each. Then you always want to make sure before going back into your NPH insulin, you'll see what I'm talking about. Before going back into your NPH insulin, you want to make sure you scrub that vial again for 15 seconds to avoid contaminating the medication. Never inject into another vial once you pull up your first insulin. Just always pull back, and if you pull back too much, you'd have to restart, get a new needle, new syringe, and just restart the process, but never inject. So here's a couple things to remember to further avoid contamination. So like I said, you never want to inject that medication. If you pulled it up too fast or pulled up too much, you'd have to restart. So to avoid restarting, you want to draw up your NPH slowly. You want to make sure you check for clumps. And if there are clumps present, you need to roll your insulin vial. You need to check the expiration date always before administering to yourself or after you get it out the fridge. Check that expiration date and check the color and appearance of your insulin as well. And also, anytime you're administering medication to yourself via syringe and needle, you never want to touch that part of the plunger that injects into that syringe, because you could introduce pathogens, bacteria into that injection site that way. Here I have some diagrams that kind of show you how you rotate your sites. But first, to let you know, the preferred location to administer insulin is in your lower abdomen, a 2-inch radius around the umbilicus, and on the left, this is not a preferred way to rotate your sites. Yeah, you're rotating it in, 4 different quadrants, but it will be better if you kind of break up each quadrant into like 4 sections. Rotating your sites like this will help you avoid scarring in those areas from the continuous poking that you're doing every day. All right, and here's a couple of tips for administration. So first, you're going to clean that site, your lower abdomen, for 30 seconds. Then you're going to pinch the skin, and you're going to dart your needle in at a 90-degree angle. And once you start injecting, release that pinch. All right. So thank you, Gloria, for your patience. Now we're going to move on to the physical demonstration. I'm going to show you on how to properly mix your insulins. Okay, Gloria, so now I'm going to show you how to mix your insulin as well as administer it to yourself. So you're going to need your syringe. Remember, they're always going to be orange capped if they're for insulin. But I'm going to go with the 30-unit syringe. I'm going to tell you why. So in your order, it says that you are to get regular insulin 5 units 3 times with meals. And then you're also supposed to get 10 units of the NPH daily once a day with your breakfast. So that equals out to 15 units total. And I'm going to go with my smaller syringe because it would be more accurate. All right, so first what you're going to do is you're going to get your vials. They would be capped if they were new. And then you just want to make sure you're checking the expiration date and you're checking to see if anything has settled to the bottom of your NPH, because your NPH is a suspension, so it is cloudy and it could have some sediment. So if you do see some sediment, you're going to want to roll your vial. Never shake it, never do anything vigorous with it. Just roll it gently back and forth to kind of make it an even concentration in there. All right. And now we're going to get started. So I'm going to go ahead and wash my hand. You should wash your hands before starting the process as well. And I'm going to put some gloves on, but you do not have to wear gloves for this if you're administering it to yourself. So put my gloves on. All right, so first off, we're going to start with alcohol pads. You're going to need about 4 of them. Just have a bunch on standby. And we're going to scrub each vial for 15 seconds. Let's do vial 2. All right, 15 seconds each, remember that. So your order says you're getting 10 units of NPH. So we're always going to draw our air up and inject our air from cloudy to clear. But when drawing up, you're going to draw up from clear to cloudy. So you're getting 10 units of NPH insulin. So you're going to draw up 10 units in air in your syringe. All right, so it's 10 units. You're gonna drop 10 units, and then you're going to inject it into your NPH vial. Make sure you're not touching the medication. Just inject it in and stabilize your vial. All right. And now we're going to go into drawing up our air for the regular insulin. So for your regular insulin, you're getting 5 units 3 times daily with meals. So you're just gonna draw up 5 units of air. All right. And then you're going to inject that into your regular insulin vial. All right. And now you're going to inject that. And then you're going to go straight into drawing it up into your syringe. So you're getting 5 units. To make sure you're accurate, you want to go slow with drawing it up. So I'm going to flip it over. And I'm going to draw up 5. All right. There's that. And if you have any bubbles, you can flick it to kind of figure that out of there. All right, and then before you re-enter your NPH vial, you're going to scrub again for 15 seconds with an alcohol swab. So for now, we're just gonna scoop this cap up to cap our needle for the meantime. And just like that. And then we're gonna take another alcohol swab and scrub your vial for 15 seconds. All right. So now you're going to take your syringe and go into your NPH vial. Remember, never inject once you're in the NPH. So I'm going to flip it over. And then I'm going to draw back 10 units. So that'll put me out to 15 units total. So I'm going to go down to 15. All right. And remember, never inject. And then I'm going to pull that out. I'm going to cap my needle back up. And then I'm going to get my skin prepped for injection. All right, so just so you know, if you go into your NPH after you go from you have drawn up your regular insulin already, and you go into your NPH to draw that one up as well, if you ever inject that fast-acting insulin into that NPH, you're gonna have to throw that medication away and get another vial because you would have contaminated the medication that's in the vial. Also, if you pull back too much, you will never administer that. Even if it's one unit off, you would never administer that. You'd want to discard of that syringe and start the whole process over again. So now we are going to go and prep our skin so we can inject. So this is a subcutaneous injection. So you're just going to be going just below the skin. And you're going to want to scrub your site, which is your lower abdomen, 2-inch radius from the umbilicus. You're going to want to scrub that area for 30 seconds. And let it dry. All right, so I'm going to take my syringe and you're going to pinch your skin. At a 90-degree angle, I'm going to dart it in. So pinch, dart, start injecting, and once you start doing that, you're going to release. Just scoop up my cap again and put this in the proper disposal area, which would either be an old milk carton, an old laundry detergent bottle, or a Sharps disposable container that you brought from pharmacy or any store that carries them. So I would discard that in there. And yeah, that is how you mix your insulin. So thank you, Gloria. Thank you for your time. And I hope this teaching was very helpful to you.